Hi, I'm Dr. Beth Kasanoff-Piper, President of the Dallas County Medical Society. I have patients ask me, Doc, what do I do if I get COVID? Is there anything that you can do for me? So I always tell them, first, be sure you're staying home and staying isolated so that you don't give it to anybody else. And be sure you're in communication with your doctor to let them know how you're feeling and so they know to keep an eye on you. Most patients with COVID do very well, but we monitor all patients closely. Make sure you're drinking enough fluids, eating healthy foods, and resting. Getting some fresh air is good too if you can do it without jeopardizing the health of anyone else in your home. It's good to have a thermometer to monitor your temperature at home, and also consider getting a pulse oximeter. They're available for about $30 from the drugstore and are a way to monitor your oxygen level at home. Anything that your doctor would normally let you take for viral symptoms, like decongestants or fever reducers, those are fine to take for COVID too. If you develop worrisome symptoms, for example, if you become short of breath or feel very weak or can't eat and drink or feel confused, those are worrisome signs and you should call your doctor or go to the emergency room right away. If you're over 65 or have underlying medical problems that increase the likelihood you could develop complications from COVID, for example, if you have chronic kidney disease, you're immunosuppressed, you have diabetes or heart problems or COPD, then you may be a candidate for monoclonal antibody therapy, and you should talk to your doctor about that possibility. Monoclonal antibodies are proteins made in a laboratory that mimic the immune system's response to a virus. They're infused into your arm through an IV, and these antibodies attack the spike protein and block the virus's attachment and entry into our cells, helping your body's own immune system fight off the virus. They aren't a cure for COVID, but they can help prevent hospitalization and progression of the illness. They're helpful only early in the course of the disease and are given in a hospital or an infusion center only if recommended by your doctor. A lot of patients ask me for steroids to treat their COVID. It's important to remember that steroids given in that first week of illness can actually be harmful by preventing your body's own response to fight off the virus. So they usually aren't given until later in the illness, and then only if people have low oxygen levels or other underlying breathing issues. Of course, the best way to treat COVID-19 is to avoid getting it at all. Get a vaccine when it's your turn and you're able to do so. Keep watching your distance, wearing your masks, and washing your hands. Thank you.